Soreness, swelling, stiffness. These are a few common symptoms of varicose veins, but there are effective treatments to get rid of these veins and finally give you relief. Dr. Sharma, founder and medical director of Arizona Vein and Laser Institute, is here to help. Good to see you.
Good morning.
How long have you been treating veins and how many treatments have you done?
Well, as a vascular surgeon, I've been doing these vascular procedures since '95. And the laser procedures I've been doing for more than 10 years now. And I've done almost close to 10,000 procedures now.
So 10,000 procedures, giving people finally their quality of life back, because there are so many types of varicose veins. There's
That's
bulging, there's spider veins. Talk a little bit about the different types of varicose veins.
Okay, we have divided these veins up to their size. Up to 1 millimeter, we call them spider veins. 1 to 3 millimeters, we call them reticular veins. And more than 3 millimeter in size, we call them varicose veins.
So the spider veins, which happens sometimes when you get pregnant, you'll start seeing the spider veins. Can they progress into varicose veins?
The spider veins, no.
Okay.
But they can become bigger in size, but they are right in the skin.
And is it a hereditary thing?
Yes.
Okay, so if your grandparents or your mother had varicose veins, or your father, you could possibly get
That's
that.
the main risk factor one has.
All right, so we want to talk a little bit today about lymphovenous disease. What is that?
Okay, the lymphatic system is one which picks up the fluid from the tissues and carries it back to the heart. So when the veins become varicose or they become thin, they leak more fluid into the tissues, and the lymphatic system has to pick it up, but somehow the lymphatic system is overwhelmed by the fluid that comes out of the veins because the veins are diseased.
So how does the lymphatic system work?
The lymphatics have small channels which run through the subcutaneous tissue, through the fatty tissue, and they go to certain stations, we call them lymph nodes, and then they are taken back to the heart.
So why do some patients, they have persistent swelling, even after they've gone through the vein surgery and the vein treatment, they still have swelling in their legs? We were just seeing an image of a patient like that.
That's right. The problem is that we as a surgeon, I evaluate them before we start the treatment, and I let them know if they have any element of lymphedema. Then I let them know that there will be persistent swelling. Unfortunately, for lymphedema, we don't have any surgical treatment.
Okay, so that's what I was going to ask you next. So how are you treating this?
Yes, there are a few things we can do for patients who are suffering from lymphedema. There are some manual compression where we need the fluid upwards. Then there is the compression stockings. Then there are some lymphatic pump, we call it. It's a pneumatic pump, which pumps the fluid upwards towards the upper body.
And so that pump, that's something that you will actually put into the leg right there in the doctor's office?
No, it's not. It's something outside.
Oh, okay.
The patients manage it at their home.
Oh, perfect.
Yeah.
So we can take this treatment home with us.
Absolutely.
And the compression socks, you say, are very vital in helping with this.
Absolutely.
And does the swelling ever go away?
Unfortunately, lymphedema is a permanent condition.
Okay.
And but if it is because of the veins problem, then once we treat the veins, the lymphedema becomes much more tolerable.
Well, we've covered a lot of ground today. Thank you so much for those explanations. Arizona Vein and Laser, they have 4 Valley locations for you. They are in Glendale, Avondale, Phoenix, and they have a new office now open in Surprise. Dr. Sharma is offering a free screening to the first 20 callers who pick up the phone, and same-day appointments are available. 602-298-VEIN, that's the number to call, 602-298-8346. You can visit them online, ArizonaVeinandLaser.com, and if you think you're experiencing symptoms of varicose veins, please email Dr. Sharma. He will answer your questions directly by email. Send your inquiries to info@ArizonaVeinandLaser.com.